गुड मॉर्निंग, राम राम, सत श्री अकाल, आदाब, सलाम, मानव सेवा परमो धर्मो. तो just we are going to start today from today onwards about the understanding to disability. As we know, in the RPWD Act there are 21 types of disabilities. So just we would like to explain about the disabilities. So this is the series understanding of disabilities. So today we will speak about the cerebral palsy. As we know, the under 21 disabilities, cerebral palsy is one of the disabilities has given legal recognition under RPWD Act. Good morning, Rajneesh bhai. So today we are going to tell you about what is the cerebral palsy, what are the causes of cerebral palsy, what are the different types of cerebral palsy, and what are the characteristic feature of various types of cerebral palsy. So let us start. I hope today weather is very cold. Today is 28th December, and I shall tell you about the cerebral palsy. What is the cerebral palsy? Cerebral palsy is a disorder of the movement and posture caused by brain damage. So this disability is caused by brain damage. This damage results in the brain sending wrong message to the muscles in the body, which control movement and balance. All children with cerebral palsy are physically disabled, and the disability may range from very minor to very severe physical problems. Most of children also have the associated problems such as learning difficulties, hearing impairment, visual impairment, specific learning problems, and epilepsy. Cerebral palsy is not hereditary nor it is infectious disease. Children with cerebral palsy can be born into families who may belong to any socio-economic background. So that is a thing. Cerebral palsy is caused due to when the child brain damages occurs during the birth period. So before and during either the cause I will tell you in the later on. The prenatal, natal and postnatal causes are there for having the disability with cerebral palsy. So I will tell you what are the causes. Cerebral palsy is caused by, as we know, the brain damage, and there are many problems and some illness that increase the risk of an infant having the cerebral palsy. These problems or illness can occur at the three different times: before the birth, during the pregnancy, that is from the time of conception to before the labor, prenatal period. Another is during the birth process, from the onset of labor pain until when the baby is born, during this called natal period. After the birth, born early childhood. So before the birth, maybe the risk occur like high risk factors that could lead to cerebral palsy includes advanced marital age, mother's age before 30 to 35 years, marriage among the close relative, consanguineous marriage may be the cause of cerebral palsy also. So we should know about what are the causes during antenatal period. So poor health or lack of good nutrition in the mother during the pregnancy may be the cause. Taking medicine without doctor's advice during the pregnancy, diseases like German measles, rubella, sexually transmitted diseases like syphilis, HIV, other viral hepatitis causes jaundice to the mother. Maybe the X-ray radiation during the pregnancy, smoke and intake alcohol during the pregnancy, illness in the mother such as diabetes and high blood pressure. So today I am describing about this to understand the disability and that one of the cerebral palsy. So बंधुओं जो आज जुड़े हैं सभी को नमस्कार। आज मैं सेरेब्रल पाल्सी के बारे में आप लोगों के बीच में रख रहा हूँ। क्यों होता है, कैसे बचाया जा सकता है, तो इसकी जानकारी थोड़ा इसलिए देता हूँ। जो लोग पैरामेडिकल स्टाफ है, जो आर वर्किंग फॉर द पर्सन विद डिसेबिलिटी, they have to understand about the disability. So today's series we have started the understanding the disabilities. So today I am telling about describing about the cerebral palsy. So during the birth I have spoken about it. Then after the birth I have to tell about during the birth. So high risk factors that could lead to cerebral palsy includes prolonged and difficult labor. Mother might have the prolonged and difficult labor may cause cerebral palsy. Careless instrumental delivery, example too much pressure with the forceps. As we know, there may be the forceps delivery also. Cord around the baby's neck causing lack of oxygen supply in the brain. That is a umbilical cord. Another obstruction in the breathing passage due to the mucus or first stool of the baby, meconium. So that may also lead during the birth, during the natal period, may cause the cerebral palsy. Then another cause is after the birth. The high risk factor could lead to cerebral palsy includes baby not breathing immediately after the birth, which result in lack of oxygen supply to the brain. Another is jaundice after the birth. It is persist for more than a week. Internal hemorrhage means that is internal brain hemorrhage, bleeding in the brain due to the injury. Premature delivery, so before the 9 months delivery. Then another is a low birth weight, and another, if the parents' blood groups do not match, it can cause a severe jaundice in the baby after the birth. Hydrocephalus or microcephalus, head size more than the average or below average, may be the cause of cerebral palsy. And then after birth, infectious diseases like meningitis, encephalitis and measles. So these are the above may be the cause of the cerebral palsy. Santosh Sajjan, good morning. Then type of cerebral palsy, as we know, there are various types of cerebral palsy, as I have spoken earlier also. So that's athertoid and mix, ataxia and mix also. So I will tell you. So that as we know, the brain is a motor cortex. As we know, the damages in the motor area of the cerebral palsy cortex cause the spasticity. So there is a motor cortex, and motor cortex, if damages due to lack of oxygen or above any causes, maybe spasticity. As we know, the basal ganglia damages in the basal ganglia causes the athetosis, and cerebellum damages in the cerebellum causes the ataxia. So the spasticity, athetoid and ataxia, I will be telling you later on. As spasticity, the muscles of the affected parts of the body have generalized tightness and stiffness, that is spasticity. These there are resistance against the movement if any of we try to move the affected limbs, the movement is difficult and slow. Tightness of the muscles increase with the excitement, fear, anxiety, children who have spasticity. Spastic type of cerebral palsy, that is the most common types are the whole body, that is a quadriplegic, one of the half body, that is a hemiplegia, the lower half of the baby more than upper half, that is a diplegia. So based on the spasticity, there are the monoplegia, diplegia, paraplegia or quadriplegia. So on based on spasticity, that is the range of motion or tightness, stiffness of the muscles. Then another type of cerebral palsy is athetoid, and the main characteristic in the individual who are having a athetosis, that is an involuntary or purposeless movement that is uncontrollable. That is, the movement is not, as we know that we have the voluntary pons and medulla that controls our involuntary movement. So that athetoid affects, or the athetosis affects the involuntary movement. That's control of the involuntary muscles also. These movements appear when the individual tries to move and interferes with the normal movement. They are increased by excitement and due to insecurity and effort to make movement. They decrease the certain postures when the person tried to sleepy or during the sleep also. Like we take breathing and we want to catch, hold anything. So that time involuntary muscles tells what to do. There is a motor nerves and sensory nerves that we perceives the sensation from outside, and the motor nerves give the reflections and gives the judgment what we have to do till the during the hypothalamus activities that so that in the basal ganglia, and we have the motor cortex that control over the pons and medulla to control the involuntary movement or involuntary muscles. Athetoid movements usually occurs in the whole body. Quadriplegia, person who have the athetosis can have hearing problem, and often we have the speech problem also. They have the problem to pronounce in anybody, it gets problem because our the soft palate and hard palate are affected due to cerebral palsy, that due to the athetoid. And then ataxia. The main problem ataxia is different of balance with the poor stability throughout the body. The voluntary movement are present but not clumsy and uncoordinated. There is sometimes difficulties in judging the distance while moving. For example, when picking up on the object, a person who is ataxic either reaches too far or not too enough. It's not able to make judgment the proper distance, that is space orientation problems. This may be accompanied by the tremor, shaking in the hands like this. So ataxia, if the person is able to stand, he often stands with the legs wide apart, raising his arms as protection to save himself from the falling. Ataxia is not a common type of cerebral palsy and usually affects the whole body, quadriplegia. Sometimes there are the mixed types of cerebral palsy also. This is the combination of any two of above three types, as I have told, that spasticity, athertoid, ataxia. So above three, if there are the mixed type, then it's called mixed type cerebral palsy. Many children with the athertoid types of cerebral palsy tend to have more tightness or spasticity as they grow older. So if and then the classification of cerebral palsy according to the body movement also. There are the types also, and we can do classification like hemiplegia, as already I have told you about. One of the half of the body is affected, the right side or left side, means upper limbs and lower limbs. One side if affected like on either left side or right side, it's called the hemiplegia. I mean, hemi means half part of body is affected, it's called hemiplegia classification. Another classification, diplegia. As we know, the involvement of whole body, but lower half of the body is more affected than upper half. This is called diplegia. And quadriplegia, whole the body means upper limbs and lower limbs are affected. That's called quadriplegia. So what we have to do, I will tell you the strategy if the person is having cerebral palsy. So we have to monitor because since birth, as we have spoken about the prenatal, natal and postnatal period. So after the birth, during the birth, before the birth and after the birth. So it's by birth we can recognize if the person baby having the cerebral palsy. So physical development, children with cerebral palsy may be delayed. The physical ability of the children will depend upon the extent of the brain damage, how much the brain damage has been occurred. And intervention goals will be depends upon the ability of age of the child. Very often the person may not be able to achieve the milestone on sitting, on standing or walking, even when they are the adult. The limit of their physical ability as adult depends upon the extent of their brain damages. Thus, intervention must include the functionally using the whatever ability they are having their daily needs, daily living activities also. Teaching them to eat, drink, dress and bath themselves are important teaching goals. However, teaching function activities will depend upon largely on the extent of their physical ability and the level of understanding. So what we have to do, if somebody, the parents or caregiver, a caretaker or professionals, they have to find out from beginning onwards how much the brain damage have, means either the child may have a spasticity, ethatoid, ataxia, or mixed type, or otherwise classification we have the monoplegia, diplegia, quadriplegia, paraplegia. So we have to first on the various level we have to see how much the physical problems is having. The physical ability level includes the with cerebral palsy like learning to control the head. So from beginning, if the unable to lift head when the lying or head on sitting positions, unable to move the chance of position, unable to use hand support or movement or function, maybe this is the possible physical problems. Learning to control the head due to that. If the able to control the head, learning to sit, then maybe unable to protect to reach out with arms while sitting the independently. Maybe another also unable to get into the out of sitting position, unable to learn forwards or backwards while sitting independently. Another the ability level may be the ability to sit or learning to stand. So what the physical problems may occur, unable to get into the out of kneeling or a standing position without support, maybe the poor balance reaction in the long sitting, kneeling and standing against the wall, unable to shift weight from the leg to the other kneeling or standing position. And if the child have ability level like able to stand and learning to walk, then may have possible to physical problems like poor balance reaction in the standing, unable to protect self while falling, unable to transfer their weight forward, backward, sideways, standing position, unable to get in out of standing position, and can take a step but unable to stop also. So these are the ones which level the cerebral palsy child having the problems. So that is the important points to remember about the cerebral palsy, that is, as we already just winding up, caused by the brain damage. As we know, problems illness that may cause cerebral palsy occur three different times: before the birth, during the birth and after birth. Already I have spoken. Cerebral palsy can be divided into 4 different types depending whether the brain the damage took place, like cerebellum, damage of the cerebellum causes ataxia, cerebellum, whole cerebellum. Motor cortex, if damages, maybe the spasticity. If the basal ganglia, if the basal ganglia affected, damage of the basal ganglia causes the ethatosis. Already I have spoken about the. And mixed type, combination of any above 3 types. So already I have told different type of. If the cerebellum affected, that's ataxia. If the motor cortex affect, that is a spasticity. If the basal ganglia affects damages, then it ethatosis. And the mixed type, combination of any above of 3. Already I have spoken about also the classification of cerebral palsy based on the body affected, that is a quadriplegia, whole body affected; hemiplegia, half body affected; diplegia, lower limbs more affected; and the monoplegia, one limb affected. So already I have spoken about this. The physical ability of person with cerebral palsy will depend on the extent of the brain damages occurred. As in the normal development, the child progresses from the lifting his head, sitting to a stand, walking. All individuals with cerebral palsy do not achieve their physical milestone due to the extent of their brain damages. So, I think 25 minutes have already spoken about cerebral palsy, so we just winding up and telling people who either who the parents or the caregivers or the professional who are working in the field of cerebral palsy. So I will next time I will explain about other disability also. This is the series of the understanding disabilities, and today I spoken about the cerebral palsy. What is the cerebral palsy? What is the causes of cerebral palsy? What are the different types of cerebral palsy, and what are the caregivers have to do based on their damage or affected body parts. So maybe already I have told that this means ataxia, spasticity, एथेटॉइड और मिक्स टाइप. सो बंधुओं, आज सेरेब्रल पाल्सी के बारे में आपको जानकारी दिया. मैं कोशिश कर रहा हूँ कि जो हमारे केयर गिवर्स है या जो पर्सन विद डिसेबिलिटी हैं पेरेंट्स से थोड़ा सा उनको इंग्लिश में भी थोड़ी जानकारी दें जिससे कि वो उसकी बातों को समझ सके. सो ये सीरीज है हमारे प्रोफेशनल्स के लिए जो इस फील्ड में काम करते हैं या केयर गिवर्स या तो दोज आर हैविंग द लैंग्वेज प्रॉब्लम्स विल bilingually. Just we have to tell about the people so they can understand, and let us work Manav Seva Parma Dharma, and we have to move ahead if the person affected from cerebral palsy, so we can understand what is a cerebral palsy, why it is different from other disabilities, what are the classification, what we can do. So later on we'll tell what will be the intervention and what are the therapeutic procedure for the different types of disability also. So उम्मीद करते हैं आज के सेशंस आपको पसंद आए हैं. फिर मिलेंगे कल या नेक्स्ट वीडियो में विथ अदर मुद्दे के साथ. तब तक के लिए हंसते रहिए, मुस्कुराते रहिए और ज्ञान लोगों में बांटते रहिए. तब तक के लिए बाय बाय, आभार, थैंक यू.